In this video we will show how to add entries to the problem list in the profile. Once the profile is up, if we select the problem list, we can add a long form diagnosis or a short form into the description. Let's do hypertension. Having done that, if we hit add, it will bring up a list of diagnoses, and we can then add the specific one we wish to choose. So let's go to essential hypertension, double click that, and it will come up. You'll see in the associated diagnoses the diagnosis here. If you wish to use a standardized abbreviation in the clinic, such as hypertension or HTN, which we do, you can leave that like that, and you can save it by just adding to the list. However, what we do, which makes it easier to see the diagnosis in the profile, the diagnostic code, we will add the 401 diagnostic code, and if the patient has been referred, we would add the physician's name for any specialist who is consistently involved in the patient's care. Let's say Dr. Int Medicine. And when we add the list, we can see that everything is visible. If we merely add a diagnosis by putting in here, let's put anemia and 280, without putting in the associated diagnosis, the field will appear blue, and this is a signal to you that really these associated diagnoses should be added. The reason for this is that when searches are done, it is in the associated fields that the system does the search, and so you won't be able to have reliable searches without this. Ideally, there should be standardization within the clinic and a consistent process that is used. Usually it will be the physician that does this, and I find that if I do not keep up with this, the minute a new diagnosis is made, it becomes impossible to maintain a good problem list, and the profile is incomplete, and it makes searches really unreliable if it's not done immediately.